The Department of Health and Human Services is overhauling the immunization schedule for children. The new proposed immunization schedule breaks up vaccines into 3 categories: vaccines for all children, vaccines for those who are at high risk, and vaccines based on shared clinical decision making, which means doctors and parents can decide what's best based on a child's health history.
You gonna sigh or what? What's up?
This is a sigh because I mean, it's 2026. We're still sighing. Okay.
Damn, we thought, on this anniversary of the insurrection, but here we are. What? He said he wasn't going to change anything.
He said he wasn't going to change anything, but I'm Dr. Haydée Brown.
And I'm Dr. Sonya Sloan.
And we are AYA,
Black and Brown Women Disruptors in healthcare and beyond. And so exactly what RFK Jr. said he wasn't going to do last February, he did. He said that, I'm not going to change the vaccine schedule or anything else, for kids. But the United States just woke up to this whole entire childhood vaccine schedule that has been normalized for years. And he has now changed it. And this is a big deal, you guys. It's a huge deal. And so over the past few days, the CDC for prevention by the HHS, your favorite person, RFK Jr., announced a significant reduction in the number of vaccines that are universally recommended for all children, or at least it was. So the decision was made without, let me emphasize that, without input from this so-called advisory committee, right, that typically does advise vaccine schedules, says the senior HHS person. They said the officials cannot say anything, the condition of anonymity, because we've been authorized not to discuss these things publicly. Well, then hell, what are they supposed to do? They are the public. Aren't they employed by us? But nonetheless, here's what you need to know. Previously, there was roughly 17 diseases for which the vaccines were recommended for all children in the United States. But now, as of this week, that list has been cut down to 11. So vaccines like the flu, the rotavirus, RSV, hepatitis A and B, and certain meningococcal strains have been moved to this whole universal category. And now they're into this shared clinical decision-making, which is considered a high-risk only status. So that isn't a bureaucratic tweak, you guys. That's policy redefinition that makes the United States schedule more likely for those more like those in Europeans. That's what Trump was asking them to do. So the administration says that we're going to build trust. We're going to reduce confusion by focusing on these recommendations of what we call core vaccines. And we're going to let the parents and the doctors work together on the rest, whatever that means. Let's roll this clip.
The Centers for Disease Control and Prevention announced that they were going to adopt a immunization schedule similar to that's used by Denmark for childhood immunization in the United States. And what that means is that we will no longer have routine recommendations for all of the things that we were recommending our children be vaccinated against. They did not take away recommendations for vaccine, but they changed many of the recommendations from a routine recommendation for all children to a recommendation that the parents and families have a discussion with a healthcare provider before they receive vaccination against RSV, hepatitis B, hepatitis A, meningococcal disease. And so this is potentially going to cause real challenges in access to vaccines for many children across the United States. While these new recommendations on paper do not take away access to vaccines to children or to families, they may, in reality, take away access, particularly for those who are vulnerable, who don't have easy access to a healthcare professional.
Get him, Dr. Brown.
So that was Dr. Robert Hopkins Jr., the medical director of the National Foundation for Infectious Diseases, speaking about the United States making this significant shift in vaccination policy this week. And this is a shift that's causing a lot of problems and drawing sharp criticism from leading medical organizations, including the leading organizations for pediatricians in the United States. So federal health officials have reduced the number of vaccines recommended for all children. Now, the change, which took effect immediately, means that the Center for Disease Control and Prevention now recommends routine vaccination against 11 diseases, down from the broader schedule that's been in place for years, even decades. So the vaccines for influenza, which New York City is having a huge surge of influenza cases, rotavirus, hepatitis A, hepatitis B, RSV, and certain forms of meningitis are no longer universally recommended. So instead, they will be offered to children that are considered high risk or administered through what the CDC calls, quote, shared clinical decision-making between families and healthcare providers. And just that phrase is a little tricky because shared clinical decision-making requires that the patient as well as the physician are informed with the most accurate clinical data available based on evidence. And that's not the information that's being shared by the CDC right now. Officials in the Trump administration say that this change will not limit access to vaccines for families who want them and that the insurance coverage will remain intact. But medical experts warn that these revised guidelines could create confusion for parents and clinicians, and they may increase the risk of preventable disease outbreaks. So while the CDC issues national recommendations, states, not the federal government, set vaccine requirements for school attendance. So some states are now exploring independent approaches in response to this new federal guidance. And so this policy shift comes as U.S. vaccination rates continue to decline. Remember, there's kids in Kentucky that died of whooping cough. We've got measles levels that are higher than they've been in 20 plus years. And so federal data has shown that childhood vaccine exemptions have reached record highs, while I just mentioned these measles and whooping cough cases are really increasing nationwide. And so the Department of Health and Human Services says the overhaul followed a December request from the current president of the United States to review how other developed nations approach childhood vaccinations. Now, that review found that the U.S. recommends more vaccines and doses than other peer countries. So administrative officials now say that this guidance is intended to rebuild public trust by focusing on what they call the most essential vaccines. Critics argue the move undermines decades of public health progress. And we're going to just go to the simplified version of what the CDC is now recommending for childhood vaccines versus what the former recommendations were. And there's less vaccines that are recommended. And this is going to have significant impact on the illnesses that we see in the United States. So the debate is now moving from policy rooms to pediatric offices, and the impact will be closely watched in the months ahead. So medical experts are raising serious concerns about the administration's changes to the vaccine schedule, saying that this decision was made without public discussion or a transparent review of scientific data, and that children are going to pay this price. And so one of the strongest warnings came from Michael Osterholm, who was the director of the Vaccine Integrity Project at the University of Minnesota. And Osterholm says that scaling back recommendations for vaccines that protect against influenza, hepatitis, and rotavirus, and altering guidance for HPV without a public risk-benefit process will have consequences. And, keep in mind, particularly with this HPV, that there are certain countries in the world now that are really decreasing the levels of cervical cancer due to the HPV vaccine, meaning that there's such a wide level of vaccination that the risk of obtaining cervical cancer has decreased significantly. We will not be in that group of countries moving forward. So it all has consequences. So Dr. Sloan, he warns that the result could be more hospitalizations and more preventable deaths among children. What do you think?
I'm going to sigh for you today. This is just absurd. I'm so dizzy with all of the craziness. But he wasn't the only pediatric leader. The Sean O'Connery, he is the president of the American Academy of Pediatrics, which is huge because they just also lost funding from the federal government because they have spoken out against the HHS and Trump's recommendations that have come through RFK Jr. So he says vaccine recommendations, you guys, are not interchangeable from country to country. Just because Denmark is doing doesn't mean the United States needs to do it, right? So they are building this new thing. our concern is you are now having addressed this advisory committee or anybody else from HHS, the disease burden, right? The population risk, as specifically the strength of our nation's health system, which is significantly lacking, right? Roll this clip.
Yeah, this was really arbitrary. And this, let me be clear, this was not from any CDC scientists. This was really a political move. As you may know, our HHS secretary has for decades really been a leader in spreading falsehoods and, frankly, lies about vaccines. And, now he's running our healthcare system. And so this, what we saw today is just one more step in his ongoing dismantling of the U.S. vaccination program.
So there you have it. Dr. O'Leary, in his own words, public health policy can't simply be copied and pasted, right? O'Leary says that what's at stake here is not just theoretical, guys. This is children's health. These are children's lives on the line. And the data from this Vaccine Integrity Project shows that most high-income countries recommend vaccines, roughly 12 to 15 vaccines for serious diseases. And now we're at 11. So even France, for example, recommends vaccines against 14 diseases for all their children. I mean, I thought Trump liked France, but nonetheless, Dr. Brown, we are under the newly revised U.S. schedule now at 14 vaccines for kids. And again, like this whole clinical decision making, like you said, people don't know what the hell they're thinking about and how to make clinical decisions because we don't even trust what some people are saying. Our providers, we're split because of the confusion at the CDC.
So, I just wanted to actually take a little quote from a group chat that I'm having with a pediatrician in the Georgia area. And she notes that she took care of a 15-year-old with meningococcal as a young peds ER doc back in the third year, right after her residency, and she worked in Chattanooga, Tennessee. They got that 15-year-old into the PICU, but he stayed intubated, right? So with a breathing tube on high-level medications called pressors to keep his blood pressure, and was on every IV antibiotic that was available. And that patient, that 15-year-old, still died. Okay, he died after 3 days of this very extensive treatment with meningococcal. So the vaccines that the CDC has moved away from recommending, that is a problem because people can die from those illnesses similar to this 15-year-old. So, health experts say the concern isn't just the comparison, right? It's this process, this transparency, whether the changes actually reflect the realities of disease risk in the United States. And so the recent CDC vaccine recommendations are sometimes compared with Denmark's schedule, but the underlying health context is so different. Denmark is not the United States, and that matters because Denmark's vaccine policies actually operate inside a universal healthcare system where access is guaranteed, unlike ours. Primary care, prevention, and follow-up are consistent, not optional or fragmented, as is the care that's administered here in the United States. Social supports actually help ensure early intervention and continuity, especially for vulnerable populations. And there's a high public trust, and there's strong data systems that allow for real-time monitoring and rapid response. There's no financial or insurance barriers to actually patients obtaining the care that's required in Denmark, right? But here in the United States, that's very different. We do not have universal coverage. As of January 1st, people's healthcare premiums went up 30+%, right? Because the Affordable Care Act subsidies expired. That access to medical care varies by zip code, income, race, immigration status, and variability changes how vaccine policy plays out in real life. So when vaccine recommendations are justified by comparisons to Denmark, the question really isn't about alignment, it's accountability. And really, although it works in Denmark, it really carries unequal consequences here. So Dr. Sloan, I think that this clip by Dr. O'Leary will go down in history as we continue to question RFK Jr.'s intentions on vaccines. Let's roll the clip.
To be honest, what diseases does he want to see children suffer from? I mean, that's what we're talking about here. The vaccines that he is scaling back are vaccines that save lives, that prevent thousands of hospitalizations. So, I would ask the secretary, what diseases do you want to see children suffer from? I really don't understand this move. It's really based not on any kind of science or evidence, but simply a political ideology.
Political standard. That's what we're dealing with, not true healthcare that is research-based. So, long story short, vaccines do save lives. Thank you guys for watching. Stay empowered, stay disruptive, and remember, your voice does matter. We're Aya, the contributors to MeidasTouch Network and proud members of the Meidas Mighty. Please subscribe, like, share, and follow for more updates. Have a great week.
Have a great week, everyone.
Want to stay plugged in? Become a subscriber to our Substack at MeidasPlus.com. You'll get daily recaps from Ron Filipkowski, ad-free episodes of our podcast, and more exclusive content only available at MeidasPlus.com.